Good afternoon, everyone. Dr. Aubry Tager here. Today I want to talk to you a little bit about traumatic brain injuries and how they can affect you and what can be done. Once again, my name is Dr. Aubry Tager. I am a doctor of natural medicine. I practice as a naturopath in the city of Montreal, just in the suburbs in a town called Pointe-Claire. Now, what I want to talk to you today about concussions is what you need to know about them and how they can actually affect you. So in the next several minutes, I'm going to be going over some important information that's going to help those that suffer from a concussion and also looking for some answers. Now, when someone suffers a concussion, all of those around them suffer as well. Now, some facts about concussion: 1.7 million people a year in the US sustain a traumatic brain injury or a concussion. One of the main problems that we see is that kids are not given enough time to heal. They're out there playing sports for their teams or for their school, and they're never given enough time to actually heal and allow them to actually deal with the recuperation of the traumatic brain injury or concussion. 52,000 people a year die as a result of concussions in the United States. 275,000 get hospitalized, and over 1.3 million are seen in the emergency room and are later released. Now let's look at some of the biomechanics. Well, the brain is basically, it's a free-floating gelatinous substance. So think of the brain kind of like a ball or a big melon that you have. So here we have a brain sitting on top of a pole. And when you're hit, the brain is actually going to move around. So it's going to rotate, it's going to go backwards and forwards, and it can actually hit the inside part of the skull. Now, one of the other main problems is that as the brain moves forward, this bottom part here, this stalk, which is where the brainstem is located, can actually get damaged as well. So this bottom part here, which we call the pituitary stock, it actually anchors the brain and the brainstem through the rest of the spinal cord. Now, as that brain slides, it can damage or bruise that pituitary stock. Why is that important? Well, the pituitary stock is where we find the connection or the housing for things like your hormones, your thyroids, your adrenal glands. So people wonder, why am I getting these concussions and then I'm having all kinds of emotional problems? Well, it's not just in your head. These are a real issue because that entire area of your body that controls the emotions is now being affected as well. So what we can see then is a decrease in energy. We might see hormonal problems or vestibular or what we call balance problems, and you can have brain problems as well. You can end up getting all of these things rolled up into one. Now, let's take a look at or talk about concussions in young athletes. Student athletes are more prone to complications in high school than they are in college because of that developmental time. As kids are going through these hormone changes, they're going to be much more prone to having complications from a concussion than they would be at an older age. There are also some differences that we see with regards to different types of sports and injuries. Soccer players, for instance, when we look at female soccer players, there are more concussions there because there was actually a correlation between neck size and strength and the incidence of a concussion. People are always talking about helmets. Are helmets good? Are they important? Are they helping us in sports like hockey and football? Well, helmets and helmet technology is important in that it's going to stop a skull fracture, but it's not going to stop you from having a concussion. Having a head-on collision in a sport, in a collision sport like football or hockey, you may not have that head split open where you need stitches, but you still can suffer from a concussion regardless of whether or not there is a helmet present. 50% of all concussions are coming from football and hockey. Now, the sport that has the least amount of concussions is actually rugby. The reason why that is because rugby players have a tendency not to use their head like weapons when they are playing the sport. Now, those who deliver the hits generally have less symptomatology than those who actually are receiving the hits. Now, when we look at the initial stages of a concussion, first of all, what we end up having is a breakdown of the blood-brain barrier. Now, when this happens, we start to see significant changes going on right away with regards to the brain. We start to see a swelling in the brain, cellular damage, and we also start to see a decrease in the vasculature by about 30% within the first 48 hours. That's what we call vasoconstriction. So the actual blood vessels are, instead of being nice and wide open, they're going to constrict down, and that's going to stop that blood flow from going to the brain. The next thing that we see is inflammation. When we hear the word inflammation, we always think that it's a bad thing. Initially, when you have a concussion, inflammation is a good thing. But the inflammation, what it's going to do is it's going to help to clean out the debris and the problems that are there. The problem comes is if the inflammation stays too long. So let's look a little bit at brain anatomy and physiology. In the brain, we have something called oligodendrocytes. And what these are, it's a big word, it just means the covering for the nerves so that it allows the nerves it allows for nerve conduction. It allows that nerve to actually function properly. We have another thing called astrocytes. So astrocytes, their function is to open the blood-brain barrier. Now, the next thing that we have is something called microglial cells. And what microglial cells are going to do is they're going to eliminate or get rid of the bad or dead neurons. Now, as soon as you start to have a concussion, you're going to have certain factors that are released, certain chemicals. One of them is what's called tumor necrosis factor. And tumor necrosis factor starts being made as soon as you hit your head. This factor, which we call short TNF, will activate those astrocytes that we just talked about and open up the blood-brain barrier. Now, once this blood-brain barrier is open, anything can come in. So those microglial cells that we talked about beforehand, they get activated and they're going to take care of all of the bad or dead neurons. This is good, but it makes you susceptible to other things that might want to try and cross the blood-brain barrier, like different viruses and bacterial infections. Now, another important thing to realize about brain anatomy is that the brain only makes one type of cell with regards to immunity. The rest of your body, you have other things like T suppressor cells. We don't have that in the brain itself. The only thing we have are these glial cells. So these glial or microglial cells, they do not shut off. There's nothing to suppress them. What ends up happening is they're going to continue to function until the neurons themselves actually die off. So how would you know if you actually had a concussion? Well, there's going to be certain symptoms that are going to come about. Some of the most common symptoms that we see are headaches, nausea, irritability, dizziness, a sensitivity to noise, forgetfulness, poor sleep, double vision, and also a lack of concentration. Now, I know a lot of you are wondering, how do you determine if a concussion has actually occurred? Well, there are some good ways in order to be able to do this, and it's becoming a little bit simpler now for teams and parents and things that are going on with regards to sport activities. There is actually a company called Sway, that's S-W-A-Y. Sway Medical is both an FDA and a Health Canada cleared medical device. And what this does is it gives you mobile objective reaction and balance testing in order to identify possible concussions. So even if you're not a doctor and you're unaware of how to actually be able to identify a concussion, if we have a baseline, if we know what a child was like before the concussion, we have something to compare it to after. And that's what Sway does. This is something that is simple to use, it's inexpensive, and it works with any Apple product. This is something that can be used by athletic therapists, coaches, teams, schools, clubs, or any kind of athletic organization. So if you want to learn some more about that, you can go to swaymedical.com, and they're going to have a lot of information. Now this application, it also allows you to be able to determine baseline testing for a comparison before and after a concussion, but it's also simple because this is a cloud-based software. It's valid and reliable. It leaves all of the guesswork behind, and it's going to save teams and parents lots of money in being able to identify the concussion and treat it. So it's going to make people more confident in their return to play decision as well, and improve the quality of care. Now the objective post-concussion, once you already know that you've had a concussion, the objective is to rid the brain of the bad cells as soon as possible, and then close that blood-brain barrier and decrease the response of those microglial cells. Any pre-existing conditions, such as an autoimmune condition, will make things worse and slow down the healing process. Now, concussions account for a total loss of over $76 million a year in the United States in treatment and lost wages. So a lot of people, when they come in to see me, they talk about their brain and they're saying, well, they're also getting nauseous, they're having some other problems with their stomach. There is a correlation. We have what's called the brain-gut axis. So the brain and the gut do not work independently of each other. There is communication there. There is a little bit of what we call the enteric nervous system, where the gut can work on its own, but it still does send messages to and from the brain. So this 80% of our immune system is actually housed in our gut. Your gut is made up of your stomach, your large intestines, your small intestine, your colon. So any kind of degenerative diseases can begin in the gut, or they can also begin in the brain and then get transferred from one to the other. Now, if this axis is not working or functioning properly, then what can happen is food can actually ferment in the gut and lead to bacterial yeast or yeast overgrowth. And when we talked about before with that blood-brain barrier being open, if there are problems in the gut and now this blood-brain barrier is open, that can allow this bacteria or virus to actually get back into the brain. So let's look at traumatic brain injury and autoimmunity. If this brain-gut axis fails, this can lead to autoimmunity. Autoimmunity, what it basically means is that the immune system is going to attack itself. It's basically a loss of self-tolerance, and we start to have what's called an increase of permeability in the gut, where things can actually get through that barrier, the screen that's around your gut, and push in, and that's what we start to call leaky gut syndrome. Now, your body can actually start making antibodies, and then it's going to start to reject things. So gluten, GMOs, soy, these are what we call immune reactive. Now, gluten is going to bind to something called synapsin. And synapsin it's a protein that's actually in the neurons. So gluten will bind to that, and it can also bind to cerebellar Purkinje cells. And if gluten binds to these cells that are in the cerebellum is what controls your balance, your coordination, and it also controls all your back muscles. So if you're having problems now and gluten is binding to that, it's going to start to destroy those cells. So can you see now how gluten can start to cause balance disorders? Your immune system is then going to start to destroy the brain and cause systemic inflammation. So what do we want to do in order to avoid this? Well, first and foremost, after a concussion, we want to eliminate or decrease the amount of carbohydrates. The brain can't handle the glycolytic pathways, so glucose right after an injury can lead to long-term free radical damage. Now, fasting in the first 48 hours after a concussion will help to clear out the debris. You don't have to totally fast, but if we can decrease the amount of food as much as possible, that's going to help to eliminate the bad debris that's in there. After 5 days, we want to be able to actually slowly introduce carbohydrates back into the diet, and we also want to control the electrolytes by decreasing the amount of sodium chloride so that the cells don't expand. So what does that mean? No Gatorade. Do not give children Gatorade after a concussion. After the initial concussion, we have what's called next impact. Now, a next impact is the next concussive force following a concussive force. So this isn't second impact, this is the next impact. What ends up happening then is half the force and twice as long a time frame each time you get hit after the initial impact. So what that means is you now get hit, you have a concussion. If you have a problem right after that, it's going to take half the amount of force and twice as long for you to heal. And that's exponential. That keeps going and going and going. Now eventually, the microglial cells that we talked about earlier are going to keep going without having any kind of trauma. So what do we want to do as far as nutrition? We want to look at specific things in order to help the body heal. So things like fish oils, essential fatty acids, magnesium glycinate, vitamin D3, co-curcumin, which is made up of a combination of coenzyme Q10 and curcumin from turmeric, which is going to help to decrease the inflammatory response. Resveratrol, that is also a great way of decreasing inflammation. Glutathione, which is the #1 antioxidant that we have in our body. And nitric balance. Nitric balance is a product that has a natural vasodilator in it, so we want to be able to open up those blood vessels and allow for more blood flow to the brain. We also want to use things like green tea extract, which is also going to help to decrease the inflammatory response. So some of the most important things with regard to nutrition after a concussion are oxygen, trying to have a paleo-type diet. Paleo is not always the best thing, but a paleo-type diet is going to be the most beneficial thing that we can deal with right now. Decrease the carbohydrates and glucose and increase the amount of protein. Some of the lifestyle things we want to address: no cell phones, no video games, no noxious smells, no aspartate, so things like MSG. The liver cannot process these toxins. We don't want to have any kind of light, 10 to 12 hours of sleep, and no loud noises. So the general time frames post-concussion, and keep in mind, these are just a guideline. 2 weeks post-concussion, it should be healed. 4 weeks post-concussion, they should be ready to go. And 1 week post-concussion, they should not be at any practice. 2 weeks, they should be going without any kind of contact if we're talking about a contact sport. 3 weeks, they're ready to return to play. And at 4 weeks, they're ready to go all the way back. So like we talked about before, 4 weeks post-concussion, they should be able to return if there are no residual or other side effects. So keep in mind, once again, this is only a guideline. All concussion diagnoses must be made by a medical doctor. I repeat, all concussion diagnoses must be made by a medical doctor. So what happens after you have that diagnosis? Well, you're going to need some therapy. So some of the things that we do here is food sensitivity testing. We're going to look at MTHFR genetic testing, which is methylene tetrahydrofolate reductase. If there was a problem in this MTHFR gene, then you might not be able to heal as fast as other people. So we want to make sure that that's not the case. Autoimmune testing. Is this an autoimmune person? Is there any nutritional deficiencies? Neurotransmitters. Are these being affected right now? Diet, nutrition, vitamins, supplementation, and we want to use nutraceuticals in order to help you get back to where you need to be. Some of the therapies that we use here in the office are brain-based therapies. These are specific therapies that are going to target the area of the brain that might be affected by a concussion. It could be in the frontal lobe, it could be in the parietal lobe, or in the occipital lobe. So some of the therapies that we do are spin therapy, which fixation. We might use a product like eyelights, or metronome therapy, which is using the timing in the brain and doing that to a metronome. We might use something called optokinetic tape or auditory or visual stimulation. We might use saccades or anti-saccadic eye movements. Warm calorics, where we inject warm water in the ear in order to stimulate the cerebellum. We might use some state-of-the-art things such as neurofeedback or neurotracker. So, what do you do now? Now that you've had a concussion, how are you going to take care of that? Well, hopefully you have a little bit better understanding of what a concussion is and what your options are. And if you want to know more, please give us a call. You can call our office at area code 514-426-6449. Once again, our office is Neurologics, and we are located in Pointe Claire, Quebec, 514-426-6449. And our website is neurologics.ca. So once again, I thank you for listening to this little talk on traumatic brain injury and concussions, and I hope that you learned something. Have a great day.